Welcome everyone to the session on navigating clinical rounds in the Indian healthcare settings. And this presentation will focus on practical insights that go beyond what you have learned in your dietetic programs in colleges. We'll cover unique challenges, opportunities that you can encounter during your internship in your hospitals. So the Indian healthcare environment has a distinct characteristics, and we know that the population is different, resource considerations are different, and clinical practices are different in different parts of the cities. So whilst we understand that these things are there, we will still have some common grounds to speak about on the internship program. So textbooks provide you fundamental knowledge, but clinical work involves complexities textbook cannot capture. So let's highlight what makes the difference. Now, patient's viability, time constraint, interdisciplinary collaborations, some emotional factors, and it will help you prepare well for your internship program. Coming to the college, they teach you a lot of theory and uh, exam materials like nutrient ratios, biochemical pathways, textbook recommendations. Okay, but what you have to apply your textbook knowledge to your practical day to day internship program. You will understand the difference. Now there would be mentors that would be helping you in the hospital. So experienced clinical dietitians, they would be helping you what you need to study and learn in the hospital. Plus in the hospital there is another different role like a hospital administrator, where you do dietetic administration, where you learn HR rules and regulations, certain other aspects of the hospital, induction programs and real case studies, and these combinations will give you a complete picture of the clinical skill and the organizational knowledge that you would require. So we are setting the stage for understanding how the hospital operates, and the focus is on physical and organizational environment. Now we will explore what makes the hospital function, from the basic structure to different departments of how they work in a hospital. Now, starting by the complexity of the Indian hospital structures. Okay, so sometimes we can feel overwhelmed that at first, but if you understand the layout properly, you will understand the success in every area. So let's walk through some of the departments that you would be probably exposed to. One is the outpatient department, that is the OPD, where you will see the highest volume of patients coming. Here the focus is on preventive care, lifestyle modifications, dietary counseling and consultation. So this is a foundation for long-term patient compliance. Then you have the IPD, that is inpatient department. Here you will be working directly with admitted patients. You will be going through the bedside assessment, writing the diet orders based on their condition. You monitor their nutritional progress throughout the stay. Sometimes these patients can be transferred to an ICU where nutrition becomes very, very critical, because here there are complex cases. You will be deciding between enteral feeds that go through the tube or parenteral nutrition that goes through the IV, and you have to adjust based on the clinical status. You also have other areas in the hospital like specialty clinics. It could to develop expertise. It could be diabetes, renal, oncology, gastro. Yeah, so all whilst you have everything, it could also be possible that you have to integrate all these areas into the medical team. So that's how you will understand different areas. So in the hospital, if you start from the admission to the discharge, at admission there is a lot of information that is collected of the patient, the detailed intake, establish baseline for their care. You also look at their previous records, where you review, assess their medical history, their lab results, and this helps you understand the cultural status and the relevant conditions. Also, when you are developing and initiated a tailoring plan for nutrition and intervention, it is based on their specific nutritional needs as well as a medical situation. Monitoring will happen continuously, track their progress throughout the stay, and begin planning for discharge. So the following structure ensures that the patient receives timely, appropriate nutrition care at every stage in the hospital. Certain aspects which are very important in a hospital setup: hand hygiene. So this is the first and most critical defense against infection. Proper hand washing before and after the patient contact, before cleaning procedures, before and after exposure to body fluids, which is non-negotiable. This is the most important aspect which you have to remember when you are going to the bedside of the patient. Standard precautions, these apply to every patient every time. Do not assume who might be infected or who might. Treat all body and body fluids, potentially contaminated materials, as if they are infectious. These include, therefore, you need to use an appropriate PPE based on the task at hand. So certain areas will require a full PPE, certain areas may require a mask. Waste management. Remember to follow the color coding for waste management. So whether it is color code for biomedical waste protocols, which is very strict segregation of disposable and medical waste, that is very important. How, in which bin you throw what waste is important. So all these elements, they work together as a comprehensive approach to infection control. This is the first thing that you should know when you are entering the hospital. They are not optional, they are essential practices that not only protect the patient, the staff, and you. Okay, and therefore the WHO guidelines on hand hygiene are very, very strict. Uh, Also, when you come to patient assessment, it is both an art and a science, and it requires a technical skill combined with clinical judgment and interpersonal sensitivity. So, we will understand how assessments happen. Coming to the BMI, now we understand that this is just one piece of the puzzle. Comprehensive assessment requires looking at multiple dimensions. So whether it's anthropometry, whether it's the MUAC, whether it is understanding the references. Especially, you should know what is the Indian guidelines. Okay, biochemical data. Read the numbers that matter. Try to read how the biochemical data actually can interpret. Blood tests are very relevant because you need to see the deficiencies. You can find out for hemoglobin, albumin, micronutrients. These are all very important. Plus, look at the clinical signs and symptoms. So whether it's edema or it is some physical changes that you can see. So you need to do an assessment thoroughly. uh, Unpacking the medical history. So let's walk through each area. It is very quickly so that you understand which area is important. So if you have to see whether the patient has a past condition, whether it is diabetes, hypertension, renal disorder. In some surgeries affect the digestion and the nutrition absorption. So you need to also understand whether this patient has got any kind of allergies, intolerances. Also here the family history matters, because if the person has a family pattern of, say, cardiovascular diseases, type 2 diabetes, obesity, prevention, ask and find out. Don't ask directly, but you should understand the socio-economic status of the patient, because when you are prescribing something, you can also remember the socio-economic status of the patient and prescribe low cost resources or low resources essentials that the patient can afford. We have to remember healthcare is very, very expensive, and therefore it has to be budget friendly. Very important for us in India is to note cultural uh, aspects of the patient, because there are many patients whom you will encounter who frequently look at traditional remedies. They look at Ayurvedic supplements, they look at home remedies. They have their own myths, their own backgrounds, their own aspects. So how do you deal with them? You cannot just shunt people saying that, oh, this is a myth and you cannot do it. You have to give them a reasonable scientific explanation to why that particular aspect has to be followed, and do so very, very carefully. Try to take the help of your mentor if you are explaining myths and to the patient, because the patient may very strongly believe in it, and hence you will have to really give a very strong scientific evidence if you want to change the mindset of the patient. Now, when you do a dietary assessment, it is more than going beyond food. So you look at 24-hour recall, you look at food frequency questionnaires, you look at diet diaries that they may be observing. Ask for fasting days, because even in the hospital they will say today is my fasting day, or today I can eat egg, today tomorrow I can't eat egg. One day they may say I can eat garlic, the other day they'll say I don't eat garlic, or they may have their own you know fasting day protocols, or there are certain festivals which people are following, so they may be vegetarian on those days. So those things need to be found, asked carefully. And because we have to remember one thing, that no one size fits all, and therefore asking relevant questions is very important, and noting it down, because you have to also inform the other people in the healthcare system what the patient needs in terms of their food. Coming to the lab reports, I understand that initially you may not understand too many of the lab reports, because it is sometimes very overwhelming. But there are basic lab reports which you need to understand, like HbA1c. You know that is a 3 month blood sugar record, which will tell you something. Also understanding what serum albumin actually means, whether it reflects the nutritional status of the patient, or whether it just reflects the protein stores of the patient. Try to understand and read the lipid profile, the creatinine test, which will help you to find out what the kidney functions are, liver function test. And these are just not numbers, they are actionable information that should guide you to do your nutrition recommendation and intervention. So always reference normal referencing when you are interpreting the result. Also, when you're reading the lab reports, you try to read in between the lines, because sometimes these lab values don't exist only in a vacuum. Okay, always look at different aspects. So suppose if you're looking at the electrolyte balance, like if you're looking at the sodium levels of the patient and you find that the patient is hyponatremic, look at the hydration status. Okay, or sometimes a dehydration can artificially elevate certain values, so look at that. Look at the medications, because there could be many drugs that affect the lab markers. Okay, inflammation can cause difference in the numbers. So if the patient is under in the cis stage, the albumin will be low, so you should understand those things. So when you are looking at markers, you remember that these markers can be different in different situations, and understand it based on the situation of the patient and not just by these numbers. So, for example, slightly elevated kidney markers could indicate that either the patient is dehydrated, not necessarily he has a kidney disease, or he may be into an AKI. But this has to be combined with the clinical judgment, and also read the notes what the doctors and the physicians are writing, because then it will help your interpretation better. Now, when we move from theory to the real world application, we actually have to create diet plans that work. Like science meets practice. Okay, so when you are understanding that the dietitians at work, they represent the hands-on nature of what we are going to understand, that how we are going to actually convert and craft our scientific knowledge, our food science knowledge into the practice and the diet plans. Coming to the three core pillars, where we know the three core pillars are energy needs of the patient. You have to estimate that properly. The macro and micro targets, which has to be estimated, whether it is your proteins and your fat, and the individual care, which is important. So all these three elements, they work together. Calculate the energy needs, set the targets accordingly. Specific diseases. Now, type 2 diabetes, type 1 diabetes, focus on the glycemic index. You understand that when you are dealing with diabetes, and when you are giving a type 1 patient with diabetes and type 2 patient with diabetes, that there is a difference in giving the diet plan. And that's how you should be able to understand where you have to give a low glycemic index diet. Similarly, whilst you are having an approach for the hypertension, try to use the dash diet, try to use renal diets for patients who are on renal diseases. However, when you're restricting protein, potassium, phosphorus, sodium, you cannot compromise on various other aspects and calories. For that, you need to understand when and why we need to restrict. Example, if you are restricting potassium for a patient on renal disease, you have to correlate it with the potassium levels of the patient, and not necessary you have to just go in blindly by saying that all renal patients will have a restricted potassium level. Similarly, what you can do is look at the ICMR 2020 guidelines and understand that a lot of referencing can come from the evidence based of the Indian population. Okay, now we know that PCOS is now PMOS, and what are the different aspects. So when you're focusing, you understand that you're giving, however, your dietary aspects will not change. Yes, uh, people, the Lancet and the other organizations have changed terminologies, but it has not changed what you will prescribe. Okay, so you will definitely prescribe, say, an anti-inflammatory food. You'll prescribe your haldi, your turmeric, your methi seeds, your flax seeds. You will explain to the patients how to restrict your refined carbs and how to look at whole grains, legumes. Also, you can address emotional eating and the other aspects. Quickly running through gut and lifestyle integrations, where you may need to give probiotics to the patients. Try to explain to them why are you giving those probiotics, how these probiotics will work in your gut, what are the prebiotics that you can add to their food. So your Indian thali is a very perfect example of a balanced diet. However, when you are explaining to the patient, you should explain the quarter plate method, where you have to divide the plate into four bits and not fill the entire thali with a lot of food without a balance. Also, communication skill, because when you look at communications, you have to use it for building a rapport to your patients, to your colleagues, and strong communication is very essential. The patient counseling is an art. Okay, and if you actually start talking to the patients, you will realize that you have to be an active listener, because sometimes patients want to talk what they feel and what they understand. So let the patients fully express themselves without your interruption. Reflect back what you have heard and show an understanding. This will build a lot of trust in the patient. Create a psychological safety for an honest conversation. You can do a motivational interviewing. Do not lecture the patients such that they feel that you are judging them. Okay, what matters most to you is about their health, and the patient has to feel that you are talking to them, you are having a conversation with them, and you're not just tick boxing everything and just giving them something that it is like your duty to complete. Okay, so work with the patient's problem, resolve their problems, and don't do work just to finish your tick box. Then, language barrier. So also, do not assume that everyone would speak English or Hindi fluently. Think if they need a regional language, try to get help from your colleagues who can speak in that language. Like if you have a Marathi speaking patient, and you may not be fluent in Marathi, and you want the patient to understand a few things, you can take help with your colleagues. Understand the cultural nuances, understand their socio-economic status, and therefore tailor your approach to each patient's language, culture, socio-economic realities, and then you advise exactly. Also, when you are collaborating, don't just attend passively. Okay, listen carefully, observe what is happening, and contribute meaningfully. Doctors are managing multiple patients. Get your point of nutrition with your doctors. Document very clearly. Make sure that all your interventions are recorded in the patient's notes, so that whoever is the other team also knows what you are doing with the patient. Build up that rapport, even if it is with the nursing staff. Spend some time with the patient and have a strong relationship with your nursing staff. That will give you a valuable insight that makes recommendations more implementable. Also, when you are communicating, collaborate skillfully with the rest of the team. Now, when you say that, in real world success comes from meeting the patients where they are, understanding their lifestyles, their preferences. Okay, this has to be done practically over a period of days. You cannot do everything on the day one that you meet the patient. Also, when you look at special population and advanced cases, you have to deal with special population differently. Like if you get a patient who is 70 or 80-year old, the first thing that you will want to ask the patient is, do you chew your food well? Can you swallow properly? So these are important aspects when you are dealing with your geriatric patients. Whilst you understand the taste and appetite also matters. When you are dealing with pediatric patients, again your approach is different. Even when it is 6 to 12 months, or it is an older kid, or it is a school going child, who you need to understand not only the growth status. Okay, in fact the IAP has given guidelines for the sources for the recommendation. The WHO also has given growth standards. Go through the growth standards and match it with the child. Also make child friendly foods which are healthy and tasty, and they look also appetizing. Now, critical assessments, gut assessment, enteral feed assessments, early enteral nutrition, ICU nutrition is huge. Okay, when you are working in an ICU, there's a lot of time and understanding you need to give, because you need to monitor the tolerance. You need to check the residual volume, the abdominal distensions, the bowel function. Lot of things need to be done. So when students come to me and tell me they want to do 1 to 2 weeks internships, there is nothing that you can actually then learn properly. So if you really want to do an internship, give enough of time for your internship so that you're able to learn properly. Also, there are different setups. So you may be put in, say, an oncology unit, or you may, when you put in an oncology unit, you will have to know how to manage those side effects, how to prevent cachexia, how to improve the quality of life of these patients. In other setups where every department patient, there is one goal, that the you have to work across the entire hospital ecosystem, whether it is post surgical, sometimes psychiatric care, sometimes pediatric, sometimes oncology, and sometimes critical care. All the areas are important. If you understand, doing case studies is important in an internship, because that will help you deep dive into the problem. Okay, where you can follow the entire nutrition care process and work your nutrition care process individually for a particular case, where you get to see the patient through and through, and deep diving will help you understand the case thoroughly. Okay, so when you are preparing for your internship report, prepare it as per the requirement, either your college requirement or either the hospital requirements. Use technology in dietetic practice, but don't just keep taking photographs and pictures and keeping it in your cell. Try to understand how they can be used. Whereas you use technology, it should not stop you from thinking, okay, and from doing critical thinking. You can use nutritional app, you can use the hospital management system, you can use everything, but remember, data privacy is very important. So do not use these things to upload on Instagram. Do not share pictures of yourself with patients on Instagram or on Facebook or any social media for that matter. Do not share patients' confidential information on your personal WhatsApp groups or even in your family WhatsApp groups. Do not discuss patients beyond the patient. Yeah, so keep data privacy as a very important aspect. Document everything in the patient's notes and in the right format of documentation. So going beyond your syllabus, hospital food service system is as important, because you need to also involve yourself in menu planning, in understanding what the patients will eat. So whether it is a sodium restricted diet, or whether it is a liquid diet, or it could be procurement from the different suppliers, getting your feeds done, getting a quality control done, getting food safety done, understand what FSSI regulations are for the hospital, and therefore you will need to also understand the standards which the hospital follows. Now, dealing with difficult patients and families. Here, if you need help, do not jump straight into solutions. First, listen, ask questions, that why is there a kind of a resistance, is there any past experience, why are the patients or the families anxious, anxiety, are they scared? There are times where you may face a conflicting situation, okay, but you have to keep calm, and that matters the most. Keep your voice steady. I always tell my interns, do not cry in front of the patient, because you are a professional, and you have to, whilst you have to empathize with the patient and sympathize at times, your tone should be respectful at all times. There should be no judgments that should be done in a unprofessional manner. And therefore you need, sometimes you may need your mentor to be besides you when you are doing such counseling. Ethical considerations are very important, and therefore you need to understand that, ensure fair and equitable access to nutrition and for all. Also, you build your professional network. Find a mentor, get your guides to help you out, get other colleague dietitians to help you out, build a rapport with them. Also, get yourself enrolled with professional bodies, whether it is the IAPN India, whether it is the IDA, whether it is the IADMK associations, whether it is your local associations, but they should be professional and they should be genuine. Do not just enter into associations that are made by the so-called quacks or people who are not qualified, because then you may not be doing the right thing. So take help of seniors in the field who will guide you properly. Also, your network is your net worth. So remember that you have to interact, and you have to encounter with people. When you make friends, do it also in a professional manner, because maintaining a professional aspect, whether it is with your doctors, nurses, ward boys, kitchen staff, butlers, service staff, everybody, whilst you maintain a professional relationship, that is very very important to engage in the right places, engage in the right manner. And if there is a issue or a problem, the first person that should be knowing is the mentor of your program. Okay, do your case studies, because the real world scenario is different. Get deep dived into the case study, understand what case studies, whether it is a type 2 diabetes in a rural setup, or whether it is malnutrition post surgical ICU. Now these are some very good case studies which you can take up, and which are important even from the exam point of view, but for it is also important for you as a person and as an individual to grow clinically. You should know, like recently the name from PCOS has changed to PMOS. So you should know all these things, what is happening in the real world scenario. Okay, try to get into deep dive into different cases which you feel that you need a little more understanding, whether it is an AKI or CKD or AKD, and understand how to give the proteins, how to give potassium restriction or sodium or phosphorus restriction for such patients. So your clinical decision framework is very very important. Gather the data. Important it is that you start collecting your relevant information that is required. Identify the problem, analyze the data, determine what the problem is, set a goal for the patient, design your intervention, and emphasize that this framework across all clinical setups. So you understand that when you design a framework, you are cutting corners that can lead to any, into the diagnosis that actually is required if you do it in a very professional manner. So you get prepared for your, whilst you prepare for your future, you have to remember you can be thrown into any healthcare settings. You could work in a hospital, you could work in a clinic setup, you could work with the government, you could work in an in our organization that is doing social service. So you have to be prepared for all the career pathways, whether it is public health, food industry, or hospital industry. All industries, you need that internship, because that internship is going to help you grow, get out of this of it is a bridge basically between what you learn in theory in college and how you manage that at your practical setup in your hospital. So you can also do various exams, especially the value added exams, whether it is diabetes management, renal nutrition. Now SPEN has also come out with the LLL programs. Do those, learn beyond what is taught to you in college itself, because that makes a lot of difference for you, to give you an edge in your day to day practices, because just degree is not enough. Okay. Interview skills for dietitians. So know your basics, tell your case stories, show that you're clinically reasoning, and ask the relevant questions. Also, your career in nutrition starts with one step. Try to look out for various ways, various places where you can learn and grow. Yes, financial is important, but when you are in the learning stage, you have to first take up the jobs that you need to learn and understand. Once you get proficient in it, that's when your value as a individual increases, your skill increases, and people will hire you for your skill. Okay, so let's recap some of the takeaways. Hospital environment, you understand the clinical setting operates, safety protocols are important, patient's assessment is very important, diet planning has to be accurate and required the way it is, communication cannot be forgotten. Also, hospital environment and patient flows, you have to understand the hospital hierarchy system, how the OPD is handled, how the IPD is handled, what is the organogram of the hospital, who's on the top, who's below the CEO, who's below, where is your dietetic chief dietitian or head dietitian placed, below her how are the senior dietitians placed, how are the junior dietitians placed, how do each one work, what are their functions. Do not forget certain aspects of the hospital, especially the infection control, where you have to remember that hygiene is first. Also remember that you can keep on improving your assessment skill, because that is the foundation of your giving a nutrition plan or the NCP for the patient. Diet planning principles, basic fundamental MNT principles, when you need to calculate rightly in the Indian context, when you're looking at, you have to leverage the ICMR guidelines for your foundation. So start that, try reading what the ICMR has said, so that you're able to correlate all the non Indian studies to the Indian context, and you can make that critical judgment. Also, communication is important whilst you collaborate with the team dynamics. So ward rounds, when you learn how to contribute, you learn how to talk to patients, you learn how to talk to the relationships with the nursing, with the medical staff, that makes you help improve even the patient care. So in advanced cases and special populations, you need to be very closely discussing every case with your mentor and your dietitian who is mentoring you, so that you are able to take the right decisions. Okay, your journey starts now, and let's look at how you will go ahead in future. Keep in touch with me, let me understand how you are growing, and let me understand where you are working. I have interned many students over these past 30 years, and most of my students are now very successful dietitians, chief dietitians of many hospitals, and I wish that you also be there one day. And I am there if you need me for anything. Let me know. My contact details are there, my mobile number is there on the slide. You can call me up, send me a WhatsApp text, or send me an email. I'm most happy to mentor you, and if you need to be mentored, do get in touch with me, so that we can work together and closely build a good nutrition fit India. So I thank you very much for this patient listening, and I'm hoping to see you all physically with me in the hospital. Bye bye.